CiaggiaNissan.com.
Welcome back. Before the break, we asked if you could guess what could be wrong with this picture of this hand. Well, what could be wrong with that hand? Well, the answer lies beneath the surface, where a whole host of problems can exist without any visible signs. Here to tell us what we should be aware of, please put your hands together, if you will, for a specialty hand surgeon, Dr. Mark Ciaglia from the Woodland Center for Special Surgery. All right. When you say hand surgery, a lot of us who saw maybe our parents go through it years ago kind of go, yikes, I don't know if I would want to do something like that. Times have changed.
They really have. Hand surgery, a relatively new specialty. It was developed after World War II, and it really prompted a lot of surgeons to look at the intricate nature of the hand, the relationship of bones, ligaments, tendons, and nerves specifically, and to really focus on taking care of them in a very focused manner.
Yeah, and it's kind of interesting what's happening in medicine now. We're seeing more specialists. A lot of times somebody who might just be a GP, general medicine, would just say, take some medicine for that. But when you specialize, you understand that the hand is much more intricate than medicine.
You really do. I trained in surgery, spent 5 years studying the entire body, and then went and specialized just in the hand.
Yeah.
All my colleagues always made fun of me. They said, you took care of everything, but now you're just focused on the hand. And it really is, because it is such a specialized field.
Yeah. One of the things that we come to know of over the last couple of decades is this thing called carpal tunnel syndrome, for example. And again, that's one of those things you might not see any visible signs on the outside, but people certainly are feeling that something's wrong.
Absolutely. And that's something that comes to my office very, very commonly. People look at their hand, and there's nothing outwardly wrong with your hand, so a lot of people don't really pay much attention to it, and they go on living with numbness, tingling. Commonly I hear people say, you know what, my hand fell asleep. Your hand should never fall asleep.
Yeah.
It should always be normal sensation. It should not be painful, and I think a lot of times people just get used to it and will continue doing it without seeking treatment, and they get comfortable. And then I commonly hear people come into the office say, oh, I wish I would have came in so much sooner, because
as in many cases, if you let it keep going, you could be causing even more damage.
You can, and permanent nerve damage is just that. It's permanent. I can't fix things that are completely destroyed and dead. I can bring sick things and make them better, but once the nerve has been permanently damaged, sometimes people are left with some residual symptoms.
Yeah, my mom had the surgery years ago where they cut open, there was a scar and the whole bit.
Yes.
That is no longer the way you have to do that surgery.
It's not. Techniques and technology, especially with medicine, have really, really advanced. I pride myself on doing a lot of minimally invasive endoscopic surgical procedures to keep the incision small, which keeps the pain very minimal, and gets the patient back to their normal everyday life as soon as possible.
Yeah.
And that's the biggest thing. People don't realize how debilitating it is when your hand is causing you pain, and they need to really get back as soon as possible.
Yeah, and then it also cuts down the risk of infection and all that type of stuff as well. Another issue with hands is this thing called tendinitis.
A very, very common thing. It's an inflammation of the tendons. Basically, our hand is like a marionette. All the muscles of our hand are actually up in our forearm, and they're connected by these long ropes or tendons. So when the muscle contracts, it pulls the finger. And you can see here, this person came in with their finger stuck in this position, and it actually had been stuck like this for several months.
Wow.
And they just kind of went on about their life thinking, well, it's just stuck. It took a 5-minute surgery, released the tendon so the finger can move, and they've gone back and have had no problems with it.
All right. And then the other thing, of course, is arthritic hands, which, again, a lot of us are led to believe that the only thing you really can do about it is perhaps take some medicine, but sometimes there are some other things you can do to lessen that pain.
It's true. Arthritis is really broken up into two categories. There's the inflammatory arthritis, like rheumatoid, and then osteoarthritis, which this photograph here is a patient who had a severe arthritis at the base of the thumb. I've developed a surgical technique to really reconstruct the base of the thumb to relieve that arthritic pain. If we all live long enough, we're all going to get arthritis. It's just a wearing out of the joints. Commonly, we've seen our moms or grandmoms with the swollen joints that are painful. And speaking, with your primary care doctor and other specialists, it's important to know that there are options out there, as opposed to just either living with the pain or constantly taking pain medications. A lot of the surgical options are very tolerable. and give you back that hand that you had without the disability.
Yeah, and again, sooner rather than later, because you could be causing
Absolutely.
more damage.
Absolutely.
Well, just to give everyone in our audience a helping hand, everyone is getting a coupon for a free hand massage at Limitless Med Spa. Limitless Med Spa. Thank you for that. And if you would like to schedule an appointment with Dr. Ciaglia or find out more information about the hand surgery options at Woodland Center for Special Surgery, just call 832-543-3431, 832-543-3431, or you can log on to their website at wcfspecialsurgery.com. And is it one of those things where if something's been bugging you for a week or 2 weeks or so and the pain's not going away, is that when you should kind of head into the specialist?
Well, yes. I mean, a lot of times my referral base comes from ERs, fractures, and obvious traumatic injuries, but speak to your primary care doctor. I work with a great group of primary care physicians, GHPMA, and they are knowledge, and talk to your primary care doc and just say, listen, something doesn't seem right with my hand. I need to see somebody, and send them to me. I'll take care of it.
All right. Thank you very much.
Thank you, Debbie.
We'll get out and explore Houston, from shopping to fine dining and plenty of family fun. We can fill your weekend agenda next.
Who needs online dating when you